Hello, I'm Linda Barlow, Managing Editor of the Healthwell Foundation blog, Real World Healthcare. Today I'm here with Dave Knowlton, the Vice Chair and Secretary of the Healthwell Board of Directors and Healthwell's Chief Compliance Officer. Welcome, Dave.
Thanks, Linda. I'm excited to be here with you.
So how did you become Healthwell's Chief Compliance Officer?
Well, I volunteered. I think compliance interested me because of my background. I've been involved in health policy my entire career, serving as the Deputy Commissioner of Health for the state of New Jersey. A little later, I founded and served as President and Chief Executive Officer of the New Jersey Healthcare Quality Institute. And that's a major not-for-profit policy institute focused on healthcare quality. I also chaired the Leapfrog Group, a national nonprofit which measures healthcare quality nationally. In all of these responsibilities, compliance was and remains a central theme.
How long have you been a member of the Healthwell Board?
Back in January of 2006, a member of the Healthwell's Board of Directors invited me to join the board. I was impressed with Healthwell's mission to provide affordable access to care, but I saw that compliance would be incredibly important to this organization. It was immediately apparent to me that the entire organization is serious about strict compliance with all the legal and regulatory requirements that surround copayment relief. And over the years, I'm proud to say, we have expanded and honed our compliance program, making it, I believe, the most comprehensive system of policies, procedures, audits, and compliance activities in the copayment foundation space.
So how have you done that?
Well, Healthwell has developed a thorough compliance manual containing essential compliance elements, including a detailed code of conduct. The foundation also requires all board and staff members to read and sign formal statements committing to confidentiality as well as conflict of interest disclosures. Healthwell also has a formal internal investigation process, as well as a third-party whistleblower process, which any employee can activate externally and anonymously if they wish.
Seems like there's a lot to manage around compliance for your foundation. How do you keep track of it all?
We manage the compliance process through a compliance calendar that follows all our compliance and risk assessment activities. For example, we monitor all the federal and state laws, regulations, policies, government investigations, litigations, settlements, and any other relevant source of legal guidance regarding compliance issues that could impact our foundation. We also use our compliance calendar to track specific compliance-related activities. One example of this tracking is regularly reviewing bylaws, personnel policies, and handbooks, as well as our compliance program's effectiveness. We also do an annual board self-evaluation, and we arrange annual compliance training for all board and staff members. Plus, we carry out contract reviews of our vendors and consultants to ensure their compliance with our standards as well.
Well, you certainly have a full plate.
Yes, it's a lot, but it's all important. I certainly couldn't do it all alone. I work closely with Healthwell's president, as well as our Associate Director of Quality, Risk Management, and Compliance. I also work very closely with Healthwell's board chair and our foundation's general counsel to ensure we're complying with a myriad of legal and regulatory requirements and to ensure we maintain a comprehensive and effective compliance program, a program with which we are all quite proud.
Yes, I can see why you and Healthwell would be proud of your comprehensive efforts and initiatives. Thank you so much for giving us a window into Healthwell's compliance program.
Thank you for your interest.